Today, we're going to have an important conversation about lung cancer. I know this might feel like a heavy topic, but my goal is to make it understandable, approachable, and even empowering. We're going to be talking about what lung cancer is, who's at risk, and how to catch it early, and how we can protect our lungs. Lung cancer is a disease that starts in the lungs when cells begin to grow out of control. These abnormal cells can form a lump called a tumor and may spread to other parts of the body. There are two main types, small cell and non-small cell, with non-small cell being the most common. However, no matter the type, catching it early gives us the best chance of successful treatment. Lung cancer is one of the most common cancers in the world and is sadly the leading cause of cancer-related death in both men and women in the US. But here's something hopeful. Deaths from lung cancer is going down. Why? Because fewer people are smoking and more people are getting screened early. That's where knowledge and prevention make a real difference. So our lungs help us breathe. As you can see on the image on the left, we take oxygen in and we put out carbon dioxide. So every time we take a breath, our lungs do this for us. It gets rid of the carbon dioxide, which our body doesn't need. When someone has lung cancer, a lump or tumor can grow and block the airways. That makes it harder to breathe and prevents us from getting enough oxygen. Over time, it can spread and cause more problems. That's why it's so important to catch it early on. Smoking is by far the biggest risk factor. In fact, around 80 to 90% of lung cancer deaths are caused by smoking. Cigarettes contain more than 7,000 chemicals, and at least 70 of them are known to cause cancer. But here's the good news. It's never too late to quit. Your body starts healing within hours, and after a few years, your risk of lung cancer drops significantly. So the sooner you stop, the better. But it's not just smoking. Breathing in secondhand smoke, being exposed to radon gas in your home, working with chemicals like asbestos or diesel fumes, and even air pollution, all of these can play a role. Family history can also matter, especially if close relatives had lung cancer. What can you do? There's more you can do to keep your lungs healthy. Avoid secondhand smoke and polluted air. Get regular exercise. Walking is great. Eat fruits and vegetables and wear a mask if you're around dust or chemicals, and get regular checkups with your doctor. These simple steps can go a long way in keeping your lungs strong and healthy. Lung cancer can be tricky because sometimes it doesn't show symptoms until it's advanced. But here are a few things to watch out for. A cough that doesn't go away, coughing up blood, shortness of breath, chest pain, hoarseness in the voice, feeling unusually tired, weight loss without trying. If you have any of these symptoms for more than a few weeks, talk to your doctor. It might be something simple, but it's always worth checking. When lung cancer is caught early before it spreads, it's much easier to treat. The problem is that most people don't know they have it until it's already advanced. That's why screening is so important. It helps catch lung cancer even when it's small and more likely to be curable. The earlier we find it, the more lives we can save. Lung cancer screening uses a test called a low-dose CT scan, or LDCT for short. It's like an advanced X-ray that takes detailed pictures of your lungs. The test is quick, painless, and can find lung cancer before symptoms even appear. It can literally be life-saving. So who should get screened? You may qualify for a screening if you're between the ages of 50 and 80 years old, if you smoked a pack a day for 20 years, or the equivalent, or 2 packs a day for 10 years, or you currently smoke or quit within the last 15 years. If that sounds like you or someone you love, it's worth talking to a doctor. And Medicare or your insurance will likely cover the scan if you meet these criteria. Here's what the scan is like. You lie on a table, the machine circles around your chest, and that's it. There are no needles, no pain, and it takes about 5 to 10 minutes. The scan uses a low dose of radiation, less than a standard CT scan, but still gives doctors a clear image of your lungs. What happens after screening? If the scan finds a spot, it doesn't necessarily mean cancer. It could be something harmless, like a scar from a past infection. Your doctor might recommend another scan in a few months just to keep an eye on it, or they may do more tests. The key thing is that if it is cancer, you've caught it early, and that's when it's most treatable. So we talked a lot about smoking. How to quit smoking. Quitting smoking can be tough, but you don't have to do it alone. Here are some helpful tools. Using nicotine patches or nicotine gum, prescription medications, quit lines you can call for support, including call 1-800-QUIT-NOW, which I put down below. There are free apps that track your progress, and support from your doctor and community groups. Even if you've tried to quit before, try again. Most people need several tries before they quit for good, and every attempt is good progress. Some people who've had COVID still feel the effects months later, especially in their lungs. This is known as long COVID. It can cause fatigue, chest discomfort, and breathing problems that linger. Vaccines reduce your chance of long COVID, and staying up to date with them is one way to protect your lungs long term. I'm putting in another slide just for further symptoms that you may experience. And there's a QR code on the bottom for more information. Some vaccines we need to talk about. As we get older, lung infections can be more serious. That's why vaccines are so important. You should ask your doctor every year about the flu shot, pneumonia vaccines, which are recommended for those over the age of 65, the RSV vaccine. It's a new option for adults over the age of 60, COVID-19 boosters to help prevent severe illnesses. These vaccines can keep your lungs healthier and help you avoid hospital visits. And here are some resources for more information for help. The American Lung Association at lung.org, CDC's lung cancer page at cdc.gov/cancer/lung, your local health department or community health center, and of course, your primary care provider. If you're eligible, Medicare may cover lung cancer screening, so don't hesitate to bring it up at your next appointment.
I like your emphasis on making sure you get screened just because catching this early is really important. So if you're someone who does qualify for screening, to make sure that you do that so you can know early on. Is a lung scan the same thing as a chest x-ray, or are those two completely different things?
They're completely different things. We talked a little bit about a lung CT. So an x-ray, the way it works is that you're going to have a machine that takes a picture of your lungs. We only get to see one side of it. We don't get to see the inner workings of your lungs, whereas a CT scan kind of takes pictures of every slice of your lung. So we don't miss anything. So if an x-ray is only showing us the first layer, the CT scan will help us see every layer. So we're not missing anything that might be behind, let's say, by your bones or by your heart. There's stuff going on. The CT scan will give us a little bit of a clearer image.